Hi, good day to everyone. My name is Wilson Salboro, and I'm here to discuss about the latest community-based management for diabetes mellitus clients. To begin with, let's start with the prevalence rate of diabetes mellitus. While communicable diseases remain an important public health issue in low and middle income countries, the rising burden of non-communicable diseases such as diabetes and their risk factors poses a double burden on health system. Diabetes is increasingly becoming a significant public health problem worldwide, leading to high morbidity and high mortality, resulting from clinically severe complication. The global diabetes prevalence, according to WHO in 2019, is estimated to be around 9.3% or about 463 million people, and it will still to continue to rise in the year 2030 by about 10.2% or 578 million, and around 10.9% or 700 million by year 2045. Okay, the global prevalence of impaired glucose tolerance or the pre-diabetes state is estimated to be around 7.5% or around 374 million in 2019 and expected to reach 8.0% or 454 million by 2030 and 8.6% or 548 million by the year 2045. According to the International Diabetes Federation, in 2020, the Philippines has a prevalence rate of 6.3%, which translates to roughly 4 million uh, people with diabetes. Okay, what are the types of community-based diabetic intervention? Okay, first we have community-based intervention for management of diabetes, or otherwise known as COBIND. Next is community-based lifestyle interventions to prevent type 2 diabetes mellitus. Next is community-based interventions for prevention of type 2 diabetes mellitus in low and middle income countries. Next is the community-based management group, community-based diabetes group pilot incorporating a community health worker and photo voice methodology in an urban primary care practice. And lastly, community-based prevention of diabetes, or known as COMPOD. These interventions listed here are only some of the interventions that are being used in the community. Uh, these interventions are all very similar in the sense that this intervention uses community health workers in providing community health teachings to the community. The only and this each of these interventions are uh, being used in different countries. The only difference with among these are one, uh, these are as I've said earlier, these are being used by different countries, and also the duration of follow-up. Some of these are being follow-up within 6 to 12 months, and some of them are also being revisited or follow-up for about a year or two. Okay. What's the purpose of community-based intervention? First is prevention, delay, and of the disease process. Okay, prevention. The focus of all the community interventions are prevention, is the prevention of the disease by eliminating the modifiable risk factors like high blood pressure, abnormal blood cholesterol or triglyceride levels, eliminating smoking, obesity, and use of certain medications, including steroids. So, if not uh, being totally prevented, at least the aim will be to delay the development of disease process, which is the development of the type 2 diabetes mellitus. This is being done through community health education by community health workers and blood glucose monitoring by uh, the people in the community. Okay, what are the effects of the community-based intervention? First, we have awareness and knowledge, lifestyle changes, decreased weight, low blood pressure, reduction in medications, encouragement and motivations. Okay, let's start with awareness and knowledge. Through health teachings in the community, people were able to become aware of the disease and acquiring knowledge, especially about the risk factors and how to prevent type 2 diabetes mellitus. With this awareness and knowledge, they utilize this to have a healthy lifestyle, thus decreasing as an effect decrease they have decrease in weight, uh, they have decrease in the blood pressure, also they have a decreased dependency in medication, which then encourage them or motivate them to continue their healthy lifestyle. Okay, let's proceed to what are the benefits of the uh, community-based intervention. Okay, one is the incidence of diabetes. Studies showed that the incidence of diabetes showed decreased risk of developing diabetes by around 40% in favor of community-based programs. With the anthropometric indices, which are body mass index, weight, and waist circumference. For the mass index, it shows significant reduction with also decrease in the waist circumference in centimeters, and also showed about significant loss of about around 2 kg weight in favor of community-based programs. The baseline of these programs are done in around 6 to 12 months, and they even after this follow-up within 6 to 12 months, it still showed consistent reduction overall after the follow-up. For the glycemic control, fasting blood sugar and the HbA1c also showed significant reduction on the results. And also for the blood pressure, uh, systolic and diastolic blood pressure showed a decrease from the baseline. So with community-based intervention, this uh, this will be the benefits that the people will get out of it. These are the references that I used for my topic. Okay, that concludes my topic. I hope you uh, have gained some information or additional knowledge about this. If you have any questions or clarifications, you can email me at wavler@hotmail.com, and I would gladly uh, answer your queries. Okay, thank you for listening, and that's all for today. Have a great day ahead and stay safe. Thank you.